Did you also know that women are 8 times more likely than men to have an abnormal thyroid function, and that the most common symptom in women with an abnormal thyroid function is irregular periods? Did you also know that 12% of people will experience an abnormal thyroid function at some point in their lives? So, hi to all of you. Welcome back to Health Angel Solutions, where we cover a wide range of topics related to women's health. Today, we'll discuss how thyroid issues or thyroid malfunction may impact menstruation. Thus, the thyroid is a little gland that surrounds your windpipe or trachea at the front of your neck. The thyroid gland resembles a butterfly with two broad wings and a tiny center. It is responsible for producing three key hormones: triiodothyronine T3, calcitonin, and thyroxine T4 are the three hormones that regulate your body's essential processes, including metabolism and reproductive hormones. The anterior pituitary gland secretes a hormone known as TSH, or thyroid-stimulating hormone. TSH actually regulates the production of thyroid hormones by telling the thyroid how much thyroxine and thiamine to make. If your thyroid is producing less thyroid hormones than usual, the pituitary increases the amount of TSH in an attempt to stimulate the thyroid gland to produce more hormones. Thus, low TSH indicates an overactive thyroid or hyperthyroidism, and high TSH indicates an underactive thyroid or hypothyroidism. If your thyroid is releasing too many hormones, the pituitary lowers TSH in an attempt to minimize the thyroid gland. Iodine, which is found in seafood and foods like iodized salt, is another crucial fact to be aware of. Iodine is needed to make the hormones T3 and T4. So let's start by discussing hypothyroidism, which is a condition in which the thyroid gland is not working properly and is not producing enough thyroid hormones, which results in fatigue, constipation due to depression, skin that is flaky and dry, fragile nails, muscle soreness, and hair loss, weight increase, and joint pain. What causes hypothyroidism is unknown, but it is also linked to early puberty, heavy, frequent, painful periods, and the inability to conceive and have abortions. The most frequent cause of hyperthyroidism is autoimmune, which refers to the formation of antibodies or immune cells in the body that function against the thyroid gland to stop it from producing thyroid hormones, as in the case of Hashimoto's thyroiditis. Genetics and family history also play a part in this condition. Pollution and environmental contaminants can also result in hypothyroidism. A diet deficient in iodine may also result in hypothyroidism. Radiation therapy and surgery for thyroid gland cancer, lithium, and amiodarone are two more drugs that might result in hypothyroidism. Next, let's discuss hyperthyroidism, a condition in which the thyroid gland produces more hormones than the body requires. A person with this condition may experience palpitations, tremors, shakiness, and even a strong sense of warmth. Despite eating more, the person tends to lose weight because they have a greater appetite, a higher propensity for diarrhea, and patients with hyperthyroidism often experience delayed puberty, shorter, more infrequent, or non-existent periods. Thyroiditis, an autoimmune thyroid infection, thyroid tumors, and excessive iodine intake are among the possible causes of hyperthyroidism. It's also crucial to remember that hypothyroidism is far more common than hyperthyroidism. Now let's examine how thyroid dysfunction can impact your menstrual cycle. First, both hypothyroidism and hyperthyroidism can lead to irregular periods due to disrupted ovulation and progesterone deficiency. Secondly, both hypothyroidism and hyperthyroidism can impact pituitary hormones such as prolactin, follicle-stimulating hormone, and LH. Lastly, hypothyroidism is known to impair insulin sensitivity, which is why up to 40% of PCOD patients also have hypothyroidism. Weight gain is another side effect of hypothyroidism that raises the risk of PCOD. Additionally, PCOD patients are more likely to have autoimmune thyroiditis, Hashimoto's. Moreover, Hypothyroidism reduces the body's coagulation factors, resulting in heavy periods, while hyperthyroidism increases them, resulting in scanty periods. Thus, it's actually rather fascinating to note that hyperthyroidism causes cancerous periods, whereas hypothyroidism produces heavy periods. In addition, there is an early stage of hypothyroidism known as subclinical hypothyroidism, in which the thyroid gland is still able to produce enough thyroid hormones despite an elevated TSH level. If treatment is not received, this condition will eventually progress to overt hypothyroidism, which is extremely important, especially if you have menstrual issues or are planning a pregnancy. All right, let's talk about the treatment for hypothyroidism. Levothyroxine is a medication that is used to replace the thyroid hormone that your body is unable to produce. Because levothyroxine is a replacement medication rather than a cure, most patients ask how long they must take it and how to monitor their TSH levels. The dosage of levothyroxine is actually dependent on your TSH level and may need to be adjusted based on your age, weight, and if you are pregnant. The treatment for hyperthyroidism may involve the use of medications such as methimazole, propylthiouracil, radioactive iodine, and occasionally thyroid gland surgery. Naturally occurring compounds called goitrogens can be found in several plant-based meals. Those with hypothyroidism should ideally avoid cruciferous vegetables such as broccoli, cauliflower, cabbage, turnip, kale, and mustard because they interfere with the thyroid gland's ability to absorb iodine. You can actually lower your intake of these vegetables by steaming or boiling them before consuming them. Even onions. Even soy-based foods contain isoflavones like genistein and diazinon. However, some studies have shown that isoflavones can also increase the symptoms of hypothyroidism. If you enjoy raw onions, it's not a good idea to eat them raw as they contain quercetin and propyldisulfide. The first natural remedy for a thyroid problem is diet. Stay away from processed, packaged foods. Stay away from alcohol and trans fats. If you have hypothyroidism, maintain a healthy homemade diet, stay away from goitrogens, we discussed them previously, and make sure you are exercising in moderation. Over-exercising is harmful and leading a sedentary lifestyle is also bad. If you have hypothyroidism, attempt to lose weight, make sure you are getting enough rest or self-care, and manage your stress. Try practicing meditation. We've talked a lot about how important restful sleep is. Thus, ensure that you're getting the recommended number of hours of high-quality sleep each night to aid with thyroid issues. Once again, if you found this information useful, please remember to like, share, and subscribe to our channel. We will see you soon. Thyroid disorders are actually hormonal disorders, but they are typically diagnosed by a gynecologist when a woman presents with irregular heavy or scanty periods. If you are diagnosed with a thyroid disorder, please do not take it lightly and take your medications regularly. Thank you for watching this video on thyroid health and its impact on your periods. We hope you found the information helpful and insightful. If you did, please give this video a thumbs up, share it with your friends and family, and don't forget to subscribe to Health Angel Solutions for more health tips and advice. Hit the bell icon to stay updated with our latest videos. Take care and stay healthy.